I have always had an interest in the health profession, but in my early career that kind of came across in education. So I did an anatomy degree when I was first left school, but then that went into science education rather than moving through health. And then I went and travelled the world and did all those other kind of things and came back and found that there was still this inkling of needing some kind of career in healing or working with people to make them feel better. I was attracted to a holistic view of the body and being able to treat a person as a whole, all the parts that make them up, rather than the one specific part that might be sore or causing them trouble. So I think it's really important to have a look at everything that's happening in someone and work out why they're getting pain in one area because of that. Before working here, I worked up in Sydney for a few years, which was a lovely experience. Yeah, so I'm very passionate about women's health and treating the little ones as well. So yeah, there are postural changes, a lot of postural changes that happen as a woman's body changes during pregnancy. And then a lot of changes as well as her body has to readjust once the baby's been born. So I'm very interested in treating those changes and supporting women as they go through all of those changes with sometimes a very new experience in their life. And if I can help them with reducing their pain or making sure their bodies are working and moving really well, then we can set up for a really great labour and then support afterwards once the baby's been born. So also having a look at babies once they've been born is really important. Really common things that we see a lot would be trouble sleeping, trouble with sort of the starting of feeding habits and position and ability to obtain the milk as well for the baby. My biggest passion would be to empower every patient that comes through the door, that they have a lot of control over their health and their pain levels. And with my history in education and my quest for knowledge and quest for nutting out what's happening and working with people and educating them, I think that's one of the biggest barriers sometimes to finding health. So I'm here for questions or try to work it out yourself so you can take the power to keep yourself healthy.